Welcome to Biochemistry DSP channel. Today I'll be discussing about fractional gastric juice analysis. If you have not subscribed the channel, please subscribe the channel Biochemistry DSP. So this is the next part of gastric juice analysis. Already in the previous video, I have talked about, I have discussed and talked about the examination of resting gastric content. That is the how we have to examine the gastric residuum. Okay, so now in today's video we'll discuss only about the fractional gastric juice analysis. Okay, so this fractional gastric juice analysis means we are going to test the gastric juice after giving a test meal. Okay, so here the test meal will be either that is two slices of bread, that is the eva test meal, or in the case of stimulant means uh, like alcohol can be a stimulant, caffeine, insulin, pentagastrin, so all these can act as a stimulant to secrete the gastric juice. Okay, so after giving a stimulant or after giving a test meal, we are going to do the analysis of gastric juice. So this is about the fractional gastric juice analysis. So after consuming a test meal, it can be either a Evart's test meal, Regel's test meal, or Bo's test meal. Okay, so after introducing the Ryle's tube into the stomach of the patient, we have to collect or aspirate the content of gastric juice at different intervals, like 15 minutes, 30 minutes, 60, 1 hour, 1.5 hours, 2 to 2.5 hours. So like that we have to, at regular interval, we should collect the gastric juice content using a Ryle's tube. So these samples what we are collecting, no, that should be analyzed for free acidity and total acidity. Then we have to interpret the results in the form of graphs. Okay, so in the fractional gastric juice analysis, total we have to aspirate the content, that is the resting gastric content, after giving the patient a test meal. Okay, so after giving the test meal, we have to collect the samples and we have to examine the free acidity. So mostly uh, actually that is we are going to assume what is free acidity and what is the total acidity. Okay, so the free acidity actually it will reach maximum at 30 to 45 minutes, then it will increase steadily to reach maximum at about 1.5 hours, after which it will decrease slowly to normal. Okay, so when we see the results in the graph, it will be very clear. So in most cases, okay, about 80% of normal individuals, the free acidity of this fasting sample, no, it will be in the range of 15 to 35 milliequivalent per liter. So that will be the normal value for free acidity. Okay, so this will be about the total acidity. When you take the total acidity of the sample, it will be about 25 to 45 milliequivalents. Okay, so after 1.5 hours, after the consumption of test meal, we can see the free acidity increases to maximum level, that is 35 to 45 milliequivalents per liter. So in normal individuals, the samples collected after test meal will not contain any blood or bile. Okay, in the case of normal individuals, whereas in the case of hyperchlorhydria, the free acidity of this gastric residuum will cross more than 45 to 50 milliequivalents per liter. Okay, so normal value of this patients will be about 15 to 35 milliequivalents, whereas if the patient is suffering from hyperchlorhydria, then the free acidity will be reaching the maximum level of 45 to 50 milliequivalent per liter. Okay, so this is a common health problem which may occurs due to stress, anxiety, or it may be due to wrong food habits like that. Okay, so this hyperchlorhydria can also be associated with gastric ulcer, duodenal ulcer. Okay, like this. In the case of peptic ulcer, the maximum free acidity will exit even 100 milliequivalent per liter after the consumption of test meal. Okay, in that hyperchlorhydria, we can also see the gastric juice may contain some amount of blood also. In a hypochlorhydria condition, there will be decreased secretion of HCl and the free acidity of the gastric residuum is found to be below normal. Okay, that is called hypoacidity or hypochlorhydria. This can be seen in the case of carcinoma of stomach, gastritis, constipation. So in these cases, we can find a hypochlorhydria, whereas in the case of achlorhydria, there will be no secretion of HCl. Okay, so these are the three conditions we can abnormal responses or conditions we can interpret with this fractional gastric juice analysis. So in hyperchlorhydria, as I told earlier, the free acidity will be more than 45 milliequivalent per liter. In hypochlorhydria, the value may be below normal value. In achlorhydria, there will be no secretion of HCl. Okay, this pathological conditions may include TB, ulcer, pernicious anemia, chronic gastritis. So maximum we can see this achlorhydria in the older age people, that is more than 70 years. Okay, so these are the clinical conditions of this test. Next, the fractional gastric juice analysis can be done after giving a stimulant. Okay, so it can be done after giving a stimulant like histamine or insulin or pentagastrin, alcohol, and caffeine. So these are the stimulant test. So we have to give a stimulant. The gastric juice will be secreted in response to this stimulant. Then we have to collect the resting gastric content after giving the patient a stimulant like histamine. So histamine means we can give 0.01 or 0.04 milligram per kg body weight. Okay, in the case of caffeine, we have to give 1.5 gram of caffeine sodium benzoate mixed in 200 ml water. Ethanol means 50 to 100 ml in that is 7% ethanol. Insulin, you have to inject zero point 0.1 to zero point 0.2 unit per kg body weight. In the case of pentagastrin, 6 microgram per kg body weight can be acting as stimulant. Okay, so these stimulants will be used to stimulate the gastric secretion. So after giving the stimulant, the samples may be collected at regular intervals, like 10 minutes, 20 minutes, like that. We have to collect it. Then it can be analyzed for free and total acidity, presence of blood, bile, pepsin, mucus, etc. Okay. Uh, Again, we have to do the same procedure to determine free acidity and total acidity. We have to check all the physical and qualitative examination for blood, bile, mucus, pepsin, as we have discussed in the previous video. Okay, so this type of gastric juice analysis, that is after giving a stimulant, uh, it will be very valuable test. Okay, this test will be more diagnostic importance to differentiate a hypochlorhydria from achlorhydria. Okay, in the case of that is the effectiveness of vagotomy in patients with duodenal ulcer, or to diagnose achlorhydria in pernicious anemia. So in these cases, if the patient has done any procedure, surgery like vagotomy uh, with the duodenal ulcer, we can differentiate clearly from hypochlorhydria from achlorhydria. Okay, so in all these cases, we can give a very good interpretation with this stimulant test. So the best example for the stimulant is a histamine stimulant test. It's a powerful stimulant for gastric acid secretion. Okay, this histamine. This histamine can stimulate gastric juice. Okay, with low pepsin content. So it can be this test can be performed to differentiate true achlorhydria from false achlorhydria. It can be of two different types, like a standard histamine test and a augmented histamine test. So in the standard histamine test, what they will do means they will collect the gastric residuum after giving histamine dose. Okay, so subcutaneously the histamine can be administered in the form of zero point 0.1 okay 0.01 milligram per kg body weight. So after administration of this histamine, we have to collect 15 ml of the gastric content at an interval of 10 minutes till 1 hour. Okay, 10 minutes, 20 minutes till 1 hour we have to get the sample, and we have to do the analysis for free acidity, presence of blood, bile, pepsin and mucus. So absence of HCl. Okay, this is the interpretance. Absence of HCl in gastric residuum and in gastric juice after giving histamine. Okay, so after giving this histamine, if there is no HCl secretion or HCl present in this gastric residuum, means it will clearly say the patient is suffering from true achlorhydria. Okay, that is Achalia gastric. It may be Achalia gastrica. Achalia gastrica means the pepsin also will not be secreted. Okay, in true achlorhydria, HCl will not be secreted or pepsin will be present. That is the difference between achlorhydria and Achalia gastrica. Okay, in augmented histamine test, what they will do means they will increase the dose from zero point zero 0.01 milligram to 0.04 milligram per kg body weight. Okay, so 0.04 milligram per kg weight of histamine will be subcutaneously administered. This high dose, no, it will act even more a powerful stimulant to synthesize this gastric juice. Okay, so it will stimulate the gastric acid secretion. Again, this test also will be used to confirm the inability of the body to secrete HCl. Okay, after giving high dose also, if the patient is not able to secrete HCl, he is suffering from achlorhydria. Okay, so after 20 minutes we have to collect 15 ml of sample, and we have to again analyze for free acidity. Absence of HCl in the gastric juice collected after administering this 0.04 milligram per kg weight indicates inability of the body to synthesize HCl. It will be observed in the case of pernicious anemia and some degeneration in the spinal cord. Okay, so in case of Achalia gastrica, no HCl will be secreted. It is also helps to assess the maximum possible acid secretion before the patient going for vagal resection or vagotomy. Okay, so in this this is the case in the case of augmented histamine test. The normal person may show up to 10 milliequivalent per hour acid. Okay, in the case of pernicious anemia, no free HCl will be secreted. In the case of duodenal ulcer, more than 100 milliequivalent of acid will be secreted. Okay, so this is the interpretation. Next is insulin stimulation test. This is also called as Hollander's test. Insulin is also a potent stimulant for gastric acid secretion. Insulin stimulates the secretion of gastric juice with low pepsin content. Insulin will cause hypoglycemia 45 to 50 milligram percent. Okay. So after collecting the gastric residuum, that is resting gastric juice, insulin should be given subcutaneously at the level of 0.1 to 0.0, that is 0.1 to 0.2 unit per kg weight. Okay, it should be this level of insulin should be given to the patient. Then we have to collect the sample 50 ml of gastric content should be collected at an interval of 15 minutes for 2.5 hours. And we have to do the analysis for free acidity, presence of blood, bile, and pepsin, mucus. Okay. So this test is performed to ascertain the effectiveness of vagotomy in patients of duodenal ulcer. Okay. So if vagotomy is performed on these patients who have duodenal ulcer, okay, so if the patient is having duodenal ulcer, means he will have the maximum secretion of more than 100 to 110 milliequivalents per liter of acid secretion. Okay, so if that vagotomy is performed correctly, means that the level of acid secretion will be reduced. Okay, so before vagotomy the level of secretion will be more, and after vagotomy, okay, you can see from the graph itself the difference. So if the vagotomy is performed, who suffer from duodenal ulcer, okay, to control this hyper secretion of gastric acid only we are doing vagotomy. Before vagotomy the free acid exceeds 100 milli equivalent per liter. So after insulin stimulation in patients, that is after the successful vagal resection, no response of insulin will be observed on gastric acid secretion, and the gastric free acidity will remain at a low level of 15 to 20 milliequivalent per liter. Before and after the insulin administration, we can see the level will be found to be in the range of 15 to 20 milliequivalent per liter. Okay, so this will as clearly will prove the effectiveness of vagotomy in patients who suffer from duodenal ulcer. Okay, so this importance of this insulin test or Hollander's test. Okay, it gives a certain to the success of vagotomy in patients who suffer from duodenal ulcer. So after successful vagotomy, insulin will not have any influence on the gastric acid secretion. That is the conclusion. Okay. Next test is pentagastrin stimulation test. So in pentagastrin, this pentagastrin is nothing but a synthetic pentapeptide. Okay, it's a high potent stimulus for gastric acid secretion. So in this test, after collecting the resting sample, uh, okay, we have to the patient should be given pentagastrin, that is 6 microgram per body weight should be given subcutaneously. Then 15 ml sample should be collected at interval of 15 minutes for 1 hour and are analyzed for free acidity and for the presence of blood, bile, pepsin, and mucus. Okay, so it is helpful, very useful test to diagnose true achlorhydria in the case of pernicious anemia, Zollinger Ellison syndrome, and duodenal ulcer. So normally the basal gastric acid secretion will range in the form from 1 to 2.5 milliequivalent per hour, which will increase to a maximum level of 20 to 40 milliequivalent per hour after the stimulation, that is after the administration of pentagastrin. In the case of duodenal ulcer, the maximum gastric acid secretion will vary from 15 to 80 milliequivalent per hour. Okay. The gastric acid will be more than 40 milliequivalent per hour in the case of duodenal ulcer. In Zollinger Ellison syndrome, elevated level of basal gastric secretion, even in the unstimulated state, we can see the level will be more than 10 milliequivalent per hour. Okay. So this is about the pentagastrin stimulation test. Then the other stimulation test is alcohol stimulant test and caffeine stimulant test. In the case of alcohol, 50 to 100 ml of 7% alcohol will be given through stomach tube. In the case of caffeine, 1.5 gram sodium benzoate salt of caffeine should be dissolved in 200 ml of water and it should be given to the patient. Okay. So this is also similar test like insulin stimulation test and pentagastrin and histamine stimulation test. So these are the tests which are done in fractional gastric juice analysis. Thank you for watching this video. Subscribe and support the channel Biochemistry DSP.